Artificial Intelligence Dr. www.abcpharma.net/English. User question: what are the long-term hemodynamic consequences of the absence of atrial pacing in patients with ventricular pacemakers? And how does this impact cardiac output and overall cardiovascular health? Claude AI answer: this is an excellent question that touches on important aspects of cardiac physiology and long-term patient outcomes. The absence of atrial pacing in patients with ventricular pacemakers can have significant hemodynamic consequences. Let's break this down. Long-term hemodynamic consequences. 1. Loss of atrial contribution to ventricular filling. Atrial contraction normally contributes 15–30% of left ventricular filling, atrial kick. Without coordinated atrial contraction, there's reduced ventricular preload. This can lead to decreased stroke volume and cardiac output, especially during exertion. 2. AV dysynchrony. Lack of coordination between atrial and ventricular contractions can lead to A. Mitral regurgitation due to contraction of ventricles against closed AV valves. B. Reduced ventricular filling time. C. Potential for Canon-A waves in jugular venous pulse. 3. Irregular heart rhythm. Ventricular pacing without atrial synchrony can result in an irregular pulse if there's competing sinus rhythm. This irregularity can impact cardiac efficiency and patient comfort. 4. Chronotropic response. Without atrial sensing or pacing, the pacemaker may not respond appropriately to physiological demands for increased heart rate. This can limit exercise capacity and cardiac output during exertion. 5. Retrograde VA conduction. In some patients, ventricular pacing can lead to retrograde conduction to the atria. This can cause pacemaker syndrome or predispose to atrial arrhythmias. 6. Atrial remodeling. Long-term lack of coordinated atrial contraction can lead to atrial enlargement and fibrosis. This remodeling increases the risk of atrial arrhythmias, particularly atrial fibrillation. Impact on cardiac output. 1. Resting cardiac output may be modestly reduced due to loss of atrial contribution. The extent varies depending on underlying cardiac function and comorbidities. 2. Exercise cardiac output. More significantly impacted due to A. Inability to increase heart rate appropriately, if rate response features are inadequate. B. Reduced ventricular filling at higher heart rates. 3. Stroke volume variability. Greater beat-to-beat variability in stroke volume due to varying ventricular filling. 4. Cardiac reserve. Reduced ability to increase cardiac output in response to stress or exercise. Impact on overall cardiovascular health. 1. Exercise intolerance. Reduced exercise capacity can lead to deconditioning and associated health risks. 2. Quality of life. Symptoms like fatigue, breathlessness, or palpitations can impact daily activities. 3. Heart failure risk. Long-term suboptimal hemodynamics may contribute to the development or progression of heart failure. 4. Atrial fibrillation. Increased risk of developing atrial fibrillation due to atrial remodeling and dysynchrony. 5. Stroke risk. Potential increase in stroke risk, particularly if atrial fibrillation develops. 6. Valvular function. Possible worsening of mitral or tricuspid regurgitation due to altered cardiac mechanics. 7. Ventricular remodeling. Long-term ventricular pacing, especially RV apical pacing, can lead to adverse ventricular remodeling. 8. Neurohumeral activation. Chronic suboptimal cardiac output may lead to increased sympathetic activation and RAS upregulation. Mitigating strategies. 1. Upgrade to dual-chamber pacing. Consider upgrading to a dual-chamber system in appropriate patients. 2. Optimized programming. Careful programming of rate response features in single-chamber devices. Minimizing unnecessary ventricular pacing if intrinsic conduction is present. 3. Regular follow-up. Close monitoring for development of atrial arrhythmias or heart failure symptoms. 4. Alternative pacing sites. Consider his bundle or left bundle branch pacing to maintain more physiological activation. 5. Medical management. Optimize medical therapy for underlying cardiac conditions. 6. Lifestyle modifications. Encourage regular exercise within limitations to maintain cardiovascular health. Conclusion. The long-term hemodynamic consequences of absent atrial pacing in ventricular pacemaker patients can be significant, potentially impacting cardiac output, exercise capacity, and overall cardiovascular health. These effects are particularly pronounced during physical exertion and can contribute to long-term cardiac remodeling and increased risk of atrial arrhythmias. Individual patient factors, including underlying cardiac function, comorbidities, and lifestyle, will influence the extent of these impacts. As such, personalized assessment and management strategies are crucial. Ongoing research into optimal pacing modalities and the long-term outcomes of different pacing strategies continues to inform clinical practice in this area.